I've spent about 30 years with kidney failure, roughly 3 to 4 years probably in total being hospitalized as an inpatient, something like 15 to 16 years on a kidney machine. And I've had 3 failed transplants. Unfortunately, I now have my 4th. So I think it's fair to say that I understand what the coalface of care is like in this country. The second hat I've got on is that of a patient modernizer. 8 years ago, I think flabbergasted is a good word, when I was asked to be involved in a £5 million project improving services in South East London in kidney care. In 22 years, I had never once been asked what my opinion was on the healthcare service. I think for me, that involvement process was life-changing. But one of the most important things that came out of it was a recognition that I had far more experience than I could have imagined. I'd effectively undergone every single part of the renal patient pathway. There are 2 key issues facing the NHS today. The first is our inability to deliver, if you like, a model of care or a business case and a business model for delivering effective long-term condition management. The second is the sometimes brutal reality that we face when we try to improve services and we work to improve services in the best way we can, when actually there are 18 million people out there with conditions like my own and whose quality of life can sometimes be difficult, if not outright appalling. Fortunately, I believe there are 2 ways that we can begin to make a change. The first, I'm looking forward to hearing today, and that's very much about involving patients in redesigning services. For me, what we were able to do was we were able to actually change a directorate. We're able to change the culture and the ethos within that directorate that began to start asking what I think are the really important questions. What do we do well? How do we know what we do well? It delivered change that was centered on self-care in a clinical setting, improved quality of life for patients and also for staff. Preemptive transplantation is basically when you give a patient who's heading for dialysis a transplant. Now, roughly recent figures have shown that saves you 34% of the cost for the first 2 years, something like $58,000 per patient if you do that. Basically, it was about creating a mechanism whereby the patients could effectively have a multidisciplinary meeting in their home. We produced a DVD that informed patients as early as possible and their family members the pros and cons of transplantation before you went on dialysis. The second area was to enable dialysis patients to be self-caring. What we did was empowered patients to begin to take a greater role in putting themselves on a kidney machine, not just weighing themselves, but actually managing the machine itself and putting their needles in. Originally, 70% of patients wanted to become more involved in their care in this way. By the end of the project, a significant minority were managing their dialysis machine themselves, totally autonomously, and that meant a 25% fall in staffing costs. The third thing I want to highlight was a national first, nocturnal dialysis. I went with clinicians back in 2003, 2004 to look at a site in Holland. And what really shook me up was when the patients on this new type of dialysis told me they didn't want a transplant. What was going on there was just such an improvement in their quality of life, a significant reduction in the medication costs. They had their life back. If you're a kidney patient, 92% of your time is spent outside of hospital. The patient experience in hospital, the 80% of time when you're looked after on a kidney machine, is important. But actually what's really important, and I think what delivers better outcomes, is whether you can manage your symptoms outside and whether you have a good quality of life. For me, the governance structure was hugely important. 20% of the steering group itself were patients, and every single one of the 13 work streams had patients involved. And lastly, whole system change events were hugely important. There were 13 in the 3 or 4 years we worked. Every single one had the same outcome. Patients, clinicians came together in the morning, said what worked, what didn't work. The bottom line was usually they agreed on everything. I'm often asked, what is my holy grail? What is the 1 or 2 things that would have made a huge difference to my quality of life? It's simple. The first is to have a system, a culture, an ethos of recognizing that patients are able to look after themselves to a varying degree, and that significant reductions in healthcare costs can result. The second is managing my symptoms, something I've strived to do for 30 years. I believe that's directly linked to the reason why patients end up in A&E. When I was 16 and at school, a boarding school, I was told I had kidney failure. I had two options. Every other day I could travel down to my hospital for 24 hours it took, 13 hours on a kidney machine, or I could spend 20 minutes 4 times a day dialysing myself. I chose the latter. The result was I got all my O's and A's, and I've worked for nearly every year of the last 30 years as a patient. The second was home dialysis, starting that. The third was I voluntarily increased my hours on dialysis, and that had a huge impact on my quality of life. It cost the £20,000 a year medication. It reduced that by about 50-60%. My quality of life significantly improved. I could eat, drink, and live more than I'd ever done before. So in conclusion, I think it's hugely important that we begin to recognise that there is a level of self-care amongst, I think, 30-40% of patients, which is beyond most of our recognition or even imagination. I believe by involving patients in both those areas, effectively in primary and secondary care, there is very significant potential, not just to improve the quality of life of patients and staff, but also to cut costs. How has involvement in redesigning services impacted me? It has taken my life from a period of unimaginable suffering, of endless days and nights of hospitalisation, sickness, and horrific symptoms, to a place where I now recognise that my illness is a gift to help others. Thank you.